I'm Deborah Beckman, speech-language pathologist. I just wanted to give you a heads up. It's really difficult for newborns if they're eating with their nose toward the ceiling. I know that is a very traditional position now, but remember in the past, in fact, before the 1950s, mommies never used bottles. They had babies at their breast. When babies are at the breast, they're on their side, ear toward the floor, not nose up. There are some important mechanical reasons for that. There is less gravity load on the jaw. It's easier for the jaw and tongue to move. Breathing is better. There's an automatic overflow outlet. And the baby is less likely to choke because any excess fluid just goes to the lower cheek instead of to the airway. When a baby is in this position, they might be able to successfully feed, but it's way harder. So they're on their back, everything's going to the back. That's why you hear that kind of sound, because they're trying to block the flow. Amazingly, many babies are just fine in that position. But why would you put them at risk if you don't need to? Here's an option. Prop your feet up so your knees are higher than your hips. Put your beautiful baby on their side, facing the hand that you use for feeding. And in this position, they can self-pace. Anytime they need to take a break, all they have to do is stop sucking. Nothing goes past their tongue until they actively swallow, so that means fewer ear infections as well. When they're eating nose up, anything that goes past the back of their tongue gets pushed right up their eustachian tubes the next time they swallow. So keep them on their side. And in this position, mommies, you can pump while the baby's taking a supplement if you need to also supplement with breast milk. Please don't feed your baby's nose up. Please keep them on their side. And the reason we have their hips bent is that also helps their GI system. If they're stretched out like this, they're getting more pressure on their belly. So L shape, neck straight, ear toward the floor, and make sure the nipple stays full. You can use a faster flow. They may tolerate that easily when they're on their side. Thank you.